rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
When you're assessing a cancer patient about to start chemo, managing their VT risk is a race against the clock. You just don't have hours to sift through guidelines to calculate their risk. You need an answer, and you need it right now.
So any solution has to be built for the reality of your clinic. It's got to be instant, completely streamlined, and of course, rigorously evidence-based.
So in this quick explainer, we're going to hit 5 key areas. We'll start with the VTE Prophylaxis challenge, then we'll decode the science behind the Khorana Score. After that, I'll show you an instant assessment tool and how this all connects from the clinic straight into a powerful research ecosystem. Okay, let's dive right into the core clinical problem. Really, the fundamental challenge is figuring out which outpatients who are about to start chemotherapy actually need VTE prevention.
You know, VTE is one of the biggest causes of harm for our patients. But we can't just put everyone on prophylaxis. The bleeding risk would be totally unacceptable. So it's all about this delicate balance. We absolutely have to pinpoint the high-risk patients who are truly going to benefit. And to do that, you need a targeted, evidence-based approach.
So, how do we strike that balance? Well, that is exactly where the Khorana Score comes in. It gives us a validated, evidence-based framework for making this precise assessment. The Khorana Score, or KRS, is a predictive model that measures the cumulative risk of a clot associated with chemotherapy. It was first developed and validated way back in a landmark 2008 study in blood, and it uses a really simple weighted system of key clinical and lab parameters that you take right before treatment starts. Now let's break down the score itself. As you can see here, it's built on 5 simple pretreatment variables. The most heavily weighted factor is the cancer's site. Very high-risk cancers like stomach or pancreas get 2 points, while other high-risk sites like lung or lymphoma get 1. From there, it's pretty straightforward. You add 1 point for each of the following: a pre-chemo platelet count over 350, a hemoglobin less than 10, or if they're on an ESA, a leukocyte count over 11, and finally, a BMI of 35 or greater. And when you add up those points, it directly stratifies patients into one of 3 clear risk categories. A score of 0? That's low risk. A score of 1 or 2 puts them in the intermediate risk bucket, and a score of 3 or more means that patient is in the high-risk category. And this chart really shows you why this stratification is so critical. Just look at this data. The observed VTE risk jumps from only 3% in the low-risk group to 8.4% in the intermediate group, and then all the way up to 12.9% for high-risk patients. This is not just some statistical noise. We're talking about a more than 4-fold increase in the likelihood of a major, potentially life-threatening event. This is the evidence that should be driving our clinical decisions. And here's the crucial part. This is not just an academic exercise. Major clinical guidelines, like the 2023 update from ASCO, directly incorporate the Khorana Score into their recommendations. They explicitly state that thromboprophylaxis may be offered to outpatients with a score of 2 or higher, which really validates its role in modern oncology today. Okay, so with the science firmly established, let's actually see how the OncoToolkit's app automates this entire evidence-based process right at the point of care. As you can see here, the interface is super clean and intuitive. The data entry is streamlined into just a few simple clicks that directly mirror those 5 Khorana parameters we just walked through: cancer site, platelets, hemoglobin, leukocytes, and BMI. And boom! In seconds, you get your result. The app calculates the total score. In this case, it's a 2, and immediately classifies the patient as intermediate risk. This gives you a clear, actionable insight that helps guide that next crucial conversation about prophylaxis. But just giving you an answer isn't enough. We believe in total transparency. That's why we say we don't believe in black boxes. The math and the reference tables are right here for your review. And this slide illustrates that principle perfectly. The app lets you instantly see the primary source evidence, including the full citation for that original 2008 Times Blood paper and the simple formula logic it's using. This ensures you can absolutely trust the result because you can see exactly how the sausage was made. Now, the utility of this tool doesn't stop with an individual patient assessment. It's actually designed to extend from the clinic directly into your research workflow. This export all to CSV feature is the bridge from your clinical application to your academic research. With just 1 click, every data point you've calculated is transformed into a clean, research-ready format. And this is not just a raw data dump. This flattened CSV is specifically structured to be the perfect starting point for deeper investigation.
ready to power your next cohort study, your retrospective analysis, and your next big discovery.
So let's zoom out and see how this exported data fits into the larger OncoToolkit research workflow.
The whole workflow is designed to be completely seamless. The CSV file you export from the Khorana Score tool becomes the direct input file you upload into our survival analysis app. You don't have to do any manual data cleaning or reformatting. It just works. And this introduces the next powerful app in our ecosystem, the Treatment Survival Analysis tool, which is built from the ground up for automated and streamlined efficacy evaluation.
Once your data is uploaded, the tool can automatically generate a whole suite of powerful publication-ready analyses. We're talking chi-square, Kaplan-Meier curves with log-rank tests, hazard ratio calculations, even subgroup hazard ratio analyses, all with graphics ready for your next manuscript or presentation.
So we'll end with this question. With the path from a point-of-care clinical assessment all the way to a publication-ready survival analysis, now streamlined to just a few clicks, what new research question will you answer next?